Good health is not just a luxury, it's a fundamental human right. Yet, millions around the world are struggling to access basic healthcare services.
As we see here today, millions of people are suffering without access to basic healthcare services. In low-income countries, the situation is even more dire. Entire communities may have just one doctor, or none at all. Hospitals are often overcrowded and under-resourced, with outdated equipment and insufficient staff.
In countries ravaged by war or conflict, healthcare systems are often destroyed. Doctors, nurses, and other healthcare professionals forced to flee, leaving populations without access to care. Poorer countries often cannot afford to build and sustain healthcare systems. This leads to a cycle where people fall into poverty
due to their inability to work. World Health Organization WHO estimates that there will be a shortage of over 18 million health workers by 2030, with the most significant gaps in low and middle income countries.
Isn't it heartbreaking having to see so many people suffer? Is there really nothing we can do to help?
Don't you know about SDG?
SDG?
Yes, SDG, Sustainable Development Goals.
Hi! I'm Putri.
I'm Iris.
I'm Aina.
Welcome to our discussion on SDG 3, Good Health and Well-being. The 2018 Agenda for Sustainable Development, adopted by all United Nations members in 2015, created 17 World Sustainable Development Goals (SDGs). They were created with the aim of peace and prosperity for people and the planet while tackling climate change and working to preserve oceans and forests. The SDGs highlight the connections between the environmental, social, and economic aspect of sustainable development. Sustainability is at the center of SDGs.
Out of the 17th SDG, we are going to look at the third one, good health and well-being. Good health and well-being is one of the 17 Sustainable Development Goals established by the United Nations in 2015. The official wording is to ensure healthy life and promotes well-being for all at all ages. The target of SDG 3 focuses on various aspects of healthy life and healthy lifestyle. Progress toward the target is measured using 21 indicators.
Target 3.1. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Target 3.2. By 2030, end preventable deaths of newborn and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. Target 3.3. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. These are also the other different targets under SDG 3, Good Health and Well-being.
Traditional healthcare system can be costly and often inaccessible, especially in rural and underserved areas. This is where innovation comes in.
By combining technology and telemedicine, we created Curabot. Curabot is not just any robot. It's a highly advanced assistant that combines artificial intelligence with a compassionate touch. Its primary goal? To assist patients due to lack of healthcare workers around the world.
Curabot's frame is made out of aluminium, which is lightweight, strong, and corrosion-resistant, while its body is made out of stainless steel, which offers durability and resistance to rust, and is often used in components exposed to medical environments. Besides that, the tires are made out of rubber and composite tires, and is specially designed to ensure that it is suitable for all environments. Curabot's hands are also equipped with ECG sensors and PPT sensors, while its eyes have temperature sensors. It is also equipped with a touchscreen which displays heartbeat, pulse rates, and other important information. These are some of the other components that are included in Curabot. With all these materials used, we can guarantee that Curabot will be the perfect innovation to help improve healthcare around the world.
This is just the beginning. As technology advances, so does our potential to change the way healthcare is delivered.
By combining innovation and compassion, we can ensure that healthcare is not just a privilege for the few, but a right for all. Thank you and bye!